Hello. Um, Once again, keeping to the promise of discussing about liver cancer and its menace in developing countries, in particular sub-Saharan Africa and Asia, I'm having to give an update about the liver cancer signs and symptoms, causes, and possible investigations that you might be required to undertake. Uh, First of all, let's start with discussing the possible causes. These are divided into several forms, including viruses, environmental toxins, and or obesity or metabolic syndromes, as well as alcohol ingestion, plus some genetic predispositions. Obviously, we know that there is no definite cause, as most cancers are. However, there has been a significant causal relationships established as to these factors I mentioned. In terms of viruses, the two most common ones responsible for liver cancer causation are hepatitis B and hepatitis C. Of course, the most relevant being hepatitis B in developing country setting. For the environmental toxins, these include aflatoxin, as well as some toxins circulating on farmlands. For example, some type of primary liver cancer known as cholangiocarcinoma has been found in people living in agricultural land use areas, and it's possible that some of the toxins within the environment, probably fertilizer and so on, might be contributing to causing this. As at yet, this is being investigated and no definite answers have returned to confirm or implicate the contribution of these fertilizers and ground nutritions in liver cancer causation. Again, toxins there might be some that are yet to be found, as we do know that there are some people who do not have any risk factors that have been found to have a liver cancer. The metabolic syndrome has been a significant contributor, in particular in recent times in the developed world. A lot of people would present with liver cancer in their probably 70s or 60s because they have had a long-term fatty liver that has not been sorted, and which eventually led to the cirrhosis, and then it would lead to liver cancer. So non-alcoholic fatty liver disease is a significant factor and has been rising in incidence with the global globicity. In other words, there is a global tendency, an epidemic of obesity, which is contributing in no small measure. That too is important. Genetic predispositions include things like hemochromatosis as well as alpha-1 antitrypsin deficiency. These are, however, rare in sub-Saharan Africa. Alcohol contribution is not small, in particular, whereas we in the West here, there is a measure of alcohol usage, and these are counted in units. In the developing countries, however, a lot of people take alcohol without any measures, and these are surreptitious. In other words, people tend to hide and don't say how much they are drinking, and that is actually a factor that has been working very, very negatively. We know that there is a tradition of using iron pots, and also the stuff used in the cereal used to sweeten, as it were, make to ferment, is normally stored in very poor conditions, often ridden by lots of aflatoxin fungi, and of course these are eventually consumed alongside with the alcohol, and of course in people who may have hepatitis and do not know, and which would enhance the chance of developing liver cancer. So these are interplaying and could be responsible for most cases of liver cancer in developing countries, in particular sub-Saharan Africa, as I mentioned before. Now, what are the symptoms of liver cancer? What do people present with? Now, for those who have cirrhosis and may be followed up, it may be picked up early, in the sense that during their surveillance, ultrasound scans, they may pick them up. So they may be asymptomatic, but this is the rarity rather than the rule. In some other patients who may not have known what is happening, or may never have known that they have had hepatitis B or C, or any of the exposures of the risk factors I had mentioned. They might present with first of all nausea, vomiting, early satiety, feeling full with small amounts of food, sometimes massive abdominal swelling, their eyes changing color to yellow, that is jaundice, and also a massive amount of lethargy. And of course, sometimes they would start having complications of liver problems, such as increased sleepiness and several factors and issues like that. Now, when you notice these symptoms, the first thing to do would be to contact your doctor, and who will then be able to make a referral, if they cannot solve your situation, to a hospital. Now, what tests can be done? Most times the scanning would be relevant. In particular, there are specific features that are observed when the scans are performed. In developed settings and where there are resources available for optimal medical care, CT scan or magnetic resonance imaging scans are important. These big scans can actually be able to use, and they have got a definite sign that is picked up that tells someone they've got liver cancer. In very rare cases, or in places where resources are limited, there's no option than to do a liver biopsy, in which case a small tissue is obtained from the liver using a local anesthetic, and then it is sampled and looked at under the microscope, and of course the diagnosis is made that way. Now, there's screening programs, because this is not applicable to many people. So there are screening programs, and that is the use of alpha-fetoprotein alongside with simple ultrasound scanning that can be done in bigger populations who are at risk. How frequently is this done? If you have a risk factor, there is a tendency that this should be done once every 6 months. Of course, this is where if you can acquire and can achieve, spending this amount of money for routine screening. Otherwise, it would be important to target those who have definite risks and who may even have cirrhosis of the liver, and would then go ahead and have the screening to pick up on time and then offer treatment to these people. There is just the very sad part in which some people may have hepatitis B and may not even pass through cirrhosis and then suddenly present with liver cancer. And that is because there is a concept of a de novo that is the liver hepatitis B virus itself enters the genetic material of the liver cell, and thereby restart or reboot the system, or direct the cell to start producing unusual cells that would then become cancerous. And that is because hepatitis B itself is carcinogenic and has that capacity to do it. That is quite rare, but it does occur, and could be the first presentation and the first time that a person who never have had hepatitis B may be diagnosed to have it at that moment. And so there's no win situation here. However, a close, careful medical examination continuously would be very helpful in picking up people who have liver cancer and for treatment to be issued to them. I think this is helpful for now. Next time we'll take a look at those risk factors and see how there is a concerted effort that needs to be put in place to pick up people on time and be able to offer treatment and or prevent people from going ahead to develop the problem of liver cancer, and thereby supporting them. I hope you would support this move by sharing this video and be able to comment and help us to be on continuously coming with information that will be helpful to you. Thank you very much for your time, and please do not forget to subscribe or like our page and keep us coming with more information that will be helpful to you. Thank you very much. Bye-bye.